One of the best ways to build trust with my special needs 15-year-old is to distract him with a discussion about the things that he is most interested in. He really likes music, he really likes video games. And so if there is a way to begin a conversation and ask questions about his interests, and then if there is a way to relate to him and his interests, whether that would be through music, through video games or technology. He's very interested in technology. Just finding a common ground, something that would be a common ground between the EMT and my child. One of the best ways to include me would just be to have a conversation. In my experiences, I have stated information about my son or the situation, and what I have said has not been taken into account. So just taking into account, as my son, I know him well, and just being engaged with both my son and me. And if my son sees that I'm having a conversation with that person, then he's going to understand, okay, mom is okay with this person, so I'm going to be okay with this person. That is going to help build trust between myself and my son and make for a more positive experience.
One of the best ways to build trust with my special needs daughter is really to just come out from the beginning and tell her that. If you talk calmly and slowly and get down to her level, so not towering over her, but maybe, approach it by going down lower and making eye contact with her, and just tell her that, introduce yourself and say, I am here to help you. You can trust me. This is a safe place for you to be. That would, from the beginning, would calm her central nervous system down, and that would help eliminate some of the pain that she feels from a stressful situation.
One of the things that, as far as emergency services, that would assist build trust with my family is a greater communication system with all of the departments that have worked together to provide services for my son. I've worked with the county, with case workers. I've worked with the partial hospitalization program, which my son attends. We've had local counseling services just through a behavioral health portion of the hospital. He has applied for services in the community for home care. There's been a great disconnect. I have found as a parent that those services, and especially with emergency personnel as well, there has not been sufficient communication between them. And it's caused myself to put more hours in trying to coordinate my son's care. I usually spend between 5 and 10 hours per week talking with the different agencies and trying to coordinate appointments and care, and sending out emails and communicating, okay, these care providers said this, these care providers said this, so that there is an overall communication happening. And I feel maybe having some more educational programs for the community would be helpful for them, that would bring those individuals in the departments together so that there's more education about the services that are offered, discussions about emergency services when those are necessary, and really connecting with parents. I've worked a lot with parents who have a strong distrust because of some of these things with individuals in the system and in the local government as well. So just getting out there and communicating with parents and making the mental health stigma not a stigma, that it's a normal part of life, and we really need to, as a community, get together and have discussions about these things and be more open